And here to talk about the flu is Dr. Amy Shadaja. He is an infectious disease expert and a senior scholar at Johns Hopkins Center for Health Security. Welcome to the program, sir. How are you?
Good. Thanks for having me.
All right. Let's get a historical perspective. We see the deaths that are happening now, but I've read about the flu epidemic of 1918 where people played cards together one evening and they went home, and the next day almost everybody who had been in the room was dead.
1918 was probably the most devastating infectious disease outbreak the human race has ever seen. And this is a virus that was very virulent, caused a lot of death and damage, and circled the globe during World War I and really changed the way infectious diseases impacted the world. And I think it's something that everybody worries about every time there's a flu season or a new flu virus that emerges. Could this be another 1918?
So when we see deaths that are occurring now, in fact, it's no way as large as what happened in 1918, but researchers like you fear that it could be that again?
This flu season is particularly severe, but it doesn't come even close to 1918 or not even 2003, 2004 season, which was pretty bad as well. This is a bad season, but it's not anything like a pandemic. And 1918 is really a whole magnitude of difference. But we do worry about other viruses in the flu family. For example, bird flu in China, for example, having the capacity to spread like 1918.
The 1918 version was called the Spanish flu. We now give number designations to flus generally. Is that because we didn't want to affect the population, or it was a misnomer? It didn't even start in Spain?
The Spanish flu is a misnomer. You have to remember this happened during World War I, and there were censorship laws in countries like the United States and in France, so they couldn't publish things that would decrease morale during the war. But the Spanish press could publish things, so the Spanish press started to report flu cases, so it got that misnomer. Actually, most science tells us now that the flu originated in the Midwest United States at an Army training camp. So it really wasn't a Spanish influenza. It was actually an American flu that basically spread around the world. We use these designations of H and N now because science has progressed very, very far with flu. Back in 1918, we didn't even know that flu was caused by a virus. They didn't even have that isolated at that time. Now we look at the molecular characteristics of a virus and give it a name based on those traits that it possesses.
So I understand that this version started in Australia. Is that correct?
Well, we first saw this version of our seasonal strain in Australia because you have to remember Australia is on the opposite side of the globe. They have the opposite flu season. So their flu season is during our summer. And they started to see an uptick of cases, and they were isolating this virus, this H3N2 there. So we had some clue that our season in the fall would start to be dominated by the H3N2 virus that we had seen in Australia. So it's hard to say whether it started there or not there, but it was noticed that this strain was dominant in Australia.
And how does it spread from Australia to America or any other nation? Airline travel?
We live in a very small world. People can get from one side of the world to the other, and you have to remember, flu comes back with regularity. The word flu comes from the Italian word influenza comes from the idea that the stars had this influence on flu because it came with certain periodicity every year, all the way back to the time of Hippocrates. So we get flu every year. It comes out in colder temperatures and spreads very rapidly because, as you saw in the earlier piece, the NBC News piece, this is something that is very contagious. It can persist in the environment on surfaces for 24 hours, and it's very attuned to spreading amongst humans. So we expect to have flu every season.
So researchers who are preparing for this have to guess, and I guess it's an educated guess, which version is going to come when they prepare a flu vaccine and then have it ready and distributed in time to get ahead of the flu season. Is that correct?
Exactly, and that's the big problem with flu vaccines. That's why we hear that they mismatch. It's because we have this long lead time to make a flu vaccine. We basically make flu vaccines the same way we did in 1940. So they have to pick the strain long before the season starts. So surprises can happen late in the season. For example, in the Southern Hemisphere, when you're watching the Southern Hemisphere trying to figure out what to put in the Northern Hemisphere vaccine, something can happen late in the season, and it's too late because you've already committed all these manufacturers to make the vaccine strains that you selected. So we inherently have this problem every year with flu vaccine, that there's this chance of a mismatch because this is a very tricky virus that mutates and changes. So we are never going to be fully prepared for flu until we get a universal flu vaccine, which is kind of the holy grail in the field.
And how close are we to that?
And there's this kind of joke in my field that we're always 5 years away from it, but that's been going on for about 20 years. So we are getting closer and closer, but it is a very tricky thing because this is a virus that mutates a lot. And because of that, it's very hard to target a vaccine to a part of the virus that doesn't change. So there are trials going on trying to find the best part of the virus particle to actually target the vaccine at. And I think we will get there. And it's really going to take a lot of commitment. And now the NIH has made it a top priority. So I do think that we will get closer and closer to it. But it's definitely what we need to prepare for flu.
Well, how have we done it with other vaccines, like for measles and other diseases?
With measles, that's a very, very effective vaccine. And the reason is because what the vaccine targets is a part of the virus that doesn't change so much. So the vaccine stays durable. And measles isn't the same as flu. Flu is almost like a deck of cards. All of its genes are on different segments, and it can affect bird species, pigs, and humans. And you get this shuffling that always happens. Flu is very, very unique in that sense. And that's why we always have seasonal outbreaks, because it's always changing in a way that many, many viruses don't do. And that's why it's kind of at the highest security threat in terms of pandemics happening and outbreaks happening. Flu is always at the top of the list because of these genetic characteristics of this virus. It's a very special virus.
A long time ago, I read a book called The Red Queen that talked about how we meet and marry one another, and all our chromosomes come together and our genes. And that's the only thing that keeps us ahead of viruses that mutate and attack us. Is that true?
Well, we know that the human immune system has lots of genetic variations, and the more varied it is, the better you are able to fend off whatever nature is going to throw at you.
So all people should intermarry then, right?
Well, definitely, genetic diversity does make the human population as a whole more resilient, because it allows genes from different groups to mix, and you get better combinations and more robust protection in your immune system. We've seen this in populations like the Ashkenazi Jewish population, where there's a lot of intermarrying, that many diseases can cluster in those groups because there's not enough genetic diversity.
Wow. I think that's amazing, to tell you the truth. So how do we prepare for this flu that is affecting America right now? And how severe is it here in Western Pennsylvania?
So Western Pennsylvania has a very high level of flu right now. We're seeing hospitals at their capacity. We've had some deaths in Allegheny County over the last week that were announced. And we're seeing a bigger uptick in cases than, for example, last year. How do we prepare for it? The best preparation, and I know I just disparaged the vaccine, is the vaccine, because this vaccine gives you some protection, and some is better than none, and it may prevent you not from getting the flu, but it may prevent you from getting hospitalized, needing a ventilator, getting pneumonia, or dying. So the flu vaccine is still the most important countermeasure people can take. We also have to be very mindful of our hygiene. Wash your hands a lot. We avoid touching surfaces that lots of people have touched. And I think that if you do have the flu, seek medical attention if you're becoming short of breath or have an unrelenting fever. You can't do anything, so that you actually get treatment with antiviral medications before it's too late.
So who are the affected populations? Is it anybody, or do the elderly and the young seem to die more?
When it comes to deaths, we usually see the very young and the very old die, and it's because the very young, before 6 months of age, aren't really eligible to get the vaccine because it doesn't work so well in them. And then the very old, because they often have other comorbid conditions, so they might
There's an age limit for the vaccine?
Yeah, we don't give it below 6 months because it doesn't work so well there, and you also have a lot of antibodies that have passed from the mother to the placenta that may block the action of the vaccine. So we start vaccinating children around 6 months. So if you're less than 6 months of age, you don't have the vaccine, and the only protection you get is from those around you and from your mother's antibody. So it is very important for pregnant women to be vaccinated, so that vaccine antibody then passes to the fetus, and then the baby's somewhat protected for the first 6 months of life. But in general, the very old and the very young, those with other medical conditions, immunocompromised patients, transplant patients, those with lung disease, heart disease, that's where we see people dying during an ordinary seasonal flu, and that's what we're seeing with this H3N2 season.
I see different estimates of how effective flu vaccines can be from year to year, and this year's, they say, is anywhere from 10 to 30% effective, but you just said that's some help.
Yeah, that is some help. It's better than zero. And you have to remember that those effectiveness studies are looking at, does it protect you from getting the flu? It's not saying, does it protect you from dying? It's not saying, does it protect you from getting pneumonia? Does it protect you from getting into the hospital? So what they're looking at is...
There's some nuances here, I hate to say.
Yeah, so
okay.
They're just saying, do you get the flu if you get the vaccine? And maybe the effectiveness is low there, but you have to think about the downstream consequences of getting the flu, and the vaccine is protective against those. And people who die from the flu are more likely to be not vaccinated. So while you might get a milder case of the flu, flu if you get vaccinated. That's no reason to say that the vaccine is worthless. The vaccine does help you from getting the worst complications of flu, and that's why I recommend it to everyone.
Is it an anomaly then when a 21-year-old bodybuilder, a young man who seems to be at the peak of his health and in his prime, gets it and dies?
It is very rare to see someone in the prime of their life, a vibrant person, die from the seasonal flu. That sometimes happens during pandemic years, but it's not unheard of. Though I said that flu likes to prey on the very young and the very old, there are going to be people in the prime of their life that die from influenza, and that's why it's so important that a young person, if they have symptoms of a bad fever, shortness of breath, that they seek medical help, because there is antiviral medications. There's a drug called Tamiflu that can be used to decrease symptoms and probably prevent some of the complications of flu.
So how does a parent tell when they're looking at their children, young children especially, is this a cold or is it a flu? Should I go to the doctor, or should I go to these overcrowded emergency rooms, which might be just petri dishes for catching something? Who knows?
There is a lot of overlap between the symptoms of the common cold and flu, but flu tends to be much more severe. So they have a higher fever, more severe symptoms, their limitations in their activities of daily living. They want to stay in bed, for example, and they also get a lot of muscle aches and pains that are very characteristic of flu and not so much with the cold. Those are some of the things that you can use to distinguish the two. But you really should seek help if you're short of breath, whether it's from the common cold or the flu, because that's when they may need oxygen, they may need antiviral therapy that you should try and get to your child.
All right, we're not going to turn this into Ask the Doctor, so you're giving medical advice over the phone, but we are ready to take some phone calls. Our number here is 412-333-PCNC. Let's go to the phones. Rich, what's your comment or question, sir?
Yeah, my question is, I'm 65 years old, and when I go to the doctor, I don't get the normal flu shot. I get a more potent one because I'm over 65. I was wondering if that helps more than the 10%, or it's basically the same.
So he's got a great question there, and we have made some incremental improvements in the flu vaccine, and one of them is the one that the caller is talking about, a high-dose vaccine that's targeted to the elderly. We know the elderly are the biggest victims of flu, and that the elderly's immune systems don't necessarily react as well as a younger person's to the vaccine. So we've developed what's called a high-dose vaccine, which has more material in it, and it is more protective, and it's been shown in clinical trials to be more protective than the ordinary vaccine. So we do recommend that to the elderly patients, and that 10%, 30% really is the regular vaccine, so it doesn't necessarily apply to the high-dose vaccine, and it's a good thing that doctors are actually offering the high-dose vaccine to older people.
Rich, how does it feel to know that you're elderly? I guess he hung up. All right. One last question before we take a break about the flu. You said to prepare, to wash your hands often, to do those sandy wipes, wiping surfaces, and that sort of thing, and wiping your hands, that lotion that you put on that's supposed to take away the germs and rub. Does that help?
It does. Hand hygiene is one of the best ways to prevent infectious diseases from spreading. And with the flu, because it gets on people's hands and people are coughing and sneezing into their hands, meticulous hand hygiene can decrease it, but it's going to be very hard. We're in the height of the flu season right now, so you're going to encounter flu no matter what. So you can lessen your chances, but it's not going to be ironclad.
And if you sneeze, really cover your mouth, and if you're in the room with them, get away from them, right? Whether they're offended or not, right?
Right, sneeze into your elbow.
Okay. All right, we're going to take a break, but we'll come back in just a second. Our number is 412-333-PCNC. Stay with us.
First rule of special ops, be aware of your surroundings. Complete visual clarity, because survival, safety, and success depend on it. These special optics give you the power to see all your surroundings. They're HD vision, special ops. Most sunglasses just make things darker, and in a tactical situation, that can be deadly.
Inspired by the needs of our men and women in uniform, Special Ops lets you do things normal sunglasses just can't do. You see your surroundings in high definition, with color, contrast, and clarity so sharp you'll never want to be without them.
And HD Vision Special Ops reduce glare without darkening your view.
Same polycarbonate material used in military aircraft. A high-performance design, ideal for active lifestyles. Special Ops offer UV protection, are scratch-resistant, and can survive the harshest conditions.
Because no matter where you are or what you do, seeing clearly can save your life.
or give you a tactical advantage even in low light conditions.
It's just the clarity of everything around you. It's like it brightens everything up.
As far as looking across the field, you can see things very clearly, which is extremely nice and very important.
The lenses are so clear, it's like there's nothing there. Everything just pops.
Tactical glasses with similar technology can cost $200 or more. But with this exclusive TV offer, you can get HD Vision Special Ops for $19.99. When you order now, you'll also get our HD Vision Night Ops glasses absolutely free. Perfect for driving at night. HD Vision Night Ops enhance color, clarity, and cut the glare of oncoming headlights. You get the HD Vision Special Ops sunglasses and our Night Ops with professional grade optics for an unbeatable low price. Both pair for just $19.99.
Don't wait. Get your special ops today.
To order, call 1-800-494-0306. That's 1-800-494-0306. Or you can go online at hdspecialops.com. Don't delay. Call or click today.
Adalja is our guest, and we are taking your calls right now. Let's go to Valerie. Valerie, what do you have to say?
Hi, good morning.
Hello.
I am 58 years old. I believe I had the flu about 2.5 to 3 weeks ago. I was sick for 10 days. My doctor gave me an antibiotic, and I'm fine now. My question is, can I get the flu again?
A couple of things. First, you shouldn't have probably gotten an antibiotic for the flu because remember, flu is a virus. So technically, people should be giving an antiviral like Tamiflu to individuals who have the flu. But yes, you can get the flu again because remember, we're talking about a season that's dominated by H3N2, but there are other strains of flu. There's an H1N1. There are 2 strains of Influenza B that are circulating. So you could get another strain of flu during this season. And sometimes during the tail end of a season, we may see a new flu virus emerge, or we may see another virus to kind of displace the H3N2. So you could technically get the flu again, but not the same strain, but maybe a related strain or a different strain.
Okay, thank you so much. I appreciate it.
All right, thank you. Dr. Adalja, let's talk about Ebola and the Zika virus. The media was talking about Ebola, how it was affecting Africa. Would it come here? People were being quarantined who came from African countries. What is the status of that? I've read that there may be another outbreak.
Ebola right now is quiet. We do know that this is a disease that springs up in parts of Africa at a sporadic basis, and usually the outbreaks are controlled. What happened during 2014 was kind of an anomaly because West Africa had never seen an Ebola outbreak. It was more of an urban outbreak in an area where there were failed states and a lot of porous borders where people basically...
Poor health care to begin with.
Yes, no infrastructure at all, and you saw this virus basically spread rampantly and get out of control. And that's not the usual case of Ebola outbreaks. They're usually much smaller and easier to control because Ebola, although it's scary and deadly, isn't a very contagious infectious disease.
Really?
Yeah, you can stop it with good infection control, giving people gowns and gloves and masks, changing burial practices so when people die from Ebola that they use appropriate personal protective equipment when they're burying
Because
bodies.
in Africa, they may bathe the body and handle it,
Yes.
and there may be an exchange of bodily fluids in that process.
Right. So
as they care for someone they cared for in life.
Right, so as soon as you implement those basic types of stuff, most Ebola outbreaks stop. What happened in West Africa was that didn't work because people weren't heeding those messages and because it was such a high-level outbreak in an urban area where there was a lot of exposure that they couldn't control, that this outbreak kind of spiraled out of control. But we've had outbreaks since that time, and they've all not really made the headlines because we know how to stop Ebola outbreaks. This was just an unfortunate circumstance that happened in West Africa, and we're very far along with the vaccine now. So Ebola may be something of the past if we can get this vaccine all the way developed.
And that was something that people weren't so, even though there was fear that it would come to America, it never really did in any major way, did it?
Right. Ebola didn't find the United States hospitable. This is a virus that thrives in areas where there's poor health infrastructure. The cases that we did get were the result of a mistake that happened at a hospital where somebody didn't recognize someone to be at risk of Ebola, and then it led to a cascade and a national panic, which could have been avoided. But Ebola was never a threat to the United States, and we knew it wasn't going to spread.
I never heard anyone say that, though. if you listen to any of the media reports, we were scared to death of a flesh-eating disease.
Right, I think that there's a lot of sensationalism that happened during Ebola, and a lot of mistakes were made because this panic that happened in the general public. It got politicized. You had governors in New York and New Jersey issuing unreasonable quarantines. You had a nurse living in a tent at Newark Airport. All of that was a huge overreaction. And the key was anytime you heard them say abundance of caution, that meant they were doing something that wasn't science or evidence-based.
Well, that's why politics affects everything, and they're playing to their electorate, I think. What about the Zika virus?
Zika is an interesting story. This was a disease that we'd known about for decades, but really hadn't done much in our side of the hemisphere until it appeared in parts of the Caribbean and Brazil. And basically, this was a kind of a trivia question, this virus, until we started seeing it have severe consequences, birth defects, Guillain-Barré syndrome, and then it spread into many different Caribbean islands, also had local spread in Texas and Florida, and really got people scared because of the damage to pregnant women and the fact that we have a huge part of the United States that has the right mosquito to spread this virus. What's happened so far is that it's quieted down this year because it was so prolific, infected so many people in the Caribbean, that now this virus doesn't have many hosts left to infect. So we've seen it
Are they immune once exposed to it?
Yeah, they are immune. So we're seeing levels go down substantially because the population was so badly affected in the last season that this season there's not many of them that the virus can actually infect.
What do you say when people get so afraid of the hype and hoopla that surfaces around things like Zika and Ebola that they don't want to take vaccines and say that these vaccines may cause childbirth defects and all sorts of things?
Vaccines are one of the greatest gifts to civilization. They basically have added decades on to every person's life. To turn against vaccine, I think, is really to go, is what I call the return of the primitive. It's to basically drag humanity back to a time when normal infectious diseases like measles could kill someone. So I think vaccines are something that are great. They should be considered like an iPhone. They are huge values, and I think when people turn against them, it's mind-boggling to me, and it's unfortunate, and it basically takes the human race back decades and decades.
So has that debate over whether vaccines cause autism been settled?
Yes, it's been settled long, long, long ago. It's not even actually a debate. It was an arbitrary
Well, some people do raise it. I have calls all the time about it.
It was an arbitrary claim from a fraudulent medical paper that got retracted. The man lost his medical license, yet celebrities picked it up and have turned it into kind of this cottage industry. And it's really unfortunate because we've got measles outbreaks all around the world because of this. And we had a record measles year last year because...
What about whooping cough? Do we see that coming back again?
Yes, we do see whooping cough coming back again. Our vaccine there isn't the best vaccine. It doesn't have as much protection as the old one, which was changed because of the anti-vaccine movement, unfortunately. But we do see pockets of whooping cough where it's spreading in California, for example, and that can kill an infant. So,
Dr. Adaja, we thank you very much for your expertise being here. We hope we can count on you in the future as an expert.
Anytime.
All right. I'm Chris Moore. Our program will continue. I hope you will continue with us by staying tuned.